Hi and hello everyone. This is your Ankita ma'am, and today we will be talking about COVID-19 under National Disaster Management and Guidance. In this presentation, we will be seeing about various causes, symptoms, treatment, and some preventive measures by which we can prevent the cause of this disease. So, students, before knowing about the symptoms, treatment methods, preventions about or against coronavirus, it is very necessary to know about what exactly or to know about this virus. This coronavirus disease is a highly infectious disease. That is, it can be spread from one person to another. That is, in layman language, you can say that this disease is a communicable disease. That is, it spreads easily from one person to another. Now, this disease COVID-19 is caused by a virus, particular type of virus, that is SARS-CoV-2, that is severe acute respiratory syndrome coronavirus 2. This is the name of the virus that is causing COVID-19. Now, this virus can infect or it can affect our respiratory tracts, that is the upper respiratory tract, which includes sinuses, nose, and our throat, and then lower respiratory tract, which includes our windpipes and lungs. So students, you must be having this bigger question in your head, which must be related to the origin of coronaviruses. That is, from where do these viruses came from? These viruses originally originated from animals. They used to stay or live on animals. And once an individual or once a healthy individual comes in close contact with these infected animals, the virus eventually jumps from the infected animals to the humans. And rest, we all know that in humans, these viruses, via close contact, they spread from one humans to another. That is, human transmission happens in the case of human. Now, many health experts believe that these viruses they have or the strains of this particular COVID-19 virus have originated either from bats or from pangolins. You can see in the picture bat and pangolins. So it is suspected that these must be the main culprit behind the origin of COVID-19 virus. The first case of transmission occurred or it was seen in Wuhan city of China, and since then the virus has mostly spread through person to person, that is by human transmission. Now, this is not the first case where we have seen such outbreaks. Earlier in 2012, that is in Saudi Arabia, we have seen MERS, which stands for Middle East Respiratory Syndrome, which came from camel, which originated from camel. Then in 2003, we have seen SARS, severe acute respiratory syndrome, which was first seen in China and came from cats. Now let's talk about how coronavirus is transmitted. That is, how could you catch this virus? Now, the primary reason for the spread of COVID-19 is through respiratory droplets. Whenever you can see in the picture given in the slide, whenever an infected person who is having COVID-19, जब भी वो coughing करेगा या फिर sneezing करेगा, what happens at that time? Water droplets which are containing COVID-19 virus will remain suspended in the air present around him. And eventually, whenever a healthy person comes in contact with those water droplets, what will happen? These healthy persons, the healthy person who will be coming in contact with the infected person, will inhale these contaminated water droplets, and those contaminated water droplets will affect or it will infect the respiratory tract of healthy human beings. Now, again, another thing is that suppose this infected person is sneezing. You can see here in the picture, this is the infected person. And the moment he will sneeze and cough, these water droplets, these small water droplets, they can land on various objects. They can land on various substances or they can land on various surfaces. And when the healthy person, this girl is a healthy person, she's not having COVID-19, when she will touch those surfaces, the water droplets will be transferred. And the moment the girl, after touching those contaminated surfaces, if she touches her mouth, nose, face, or anything, Eventually, these water droplets will go inside the body and will infect the respiratory tract. Okay, and now COVID-19 can last, or the viruses causing COVID-19, CoV-2, can last for several hours or hours on various types of surfaces. Now, depending upon the type of surfaces these viruses can last. For example, in the case of copper, they can last for 4 hours. In the case of cardboard, that is substances which are made up of paper, the COVID-19 can last for 24 hours. In plastic and stainless steels, these viruses can remain for 2 to 3 days. And this is the reason why it is said that you're supposed to disinfect the surfaces to get rid of the viruses before using the surfaces. Or whenever you are out, you are supposed to use sanitizers or you are supposed to use disinfectant sprays to disinfect the objects which are near to you. So now, once a healthy person gets exposed to the virus or he or she is infected with the virus, it takes some time to show the symptoms or to show the signs. So that period is known as incubation period. You can see here in the slide, the period between the exposure to an infection and the appearance of the first symptoms is known as incubation period. And according to CDC and WHO, incubation period in the case of COVID-19 is 2 to 14 days. That is, it may require from 2 to 14 days to show the sign of COVID-19. And तभी तुम लोगों ने, you have seen in the news that it is said that people, those who are suspected to be having COVID-19 or those who come in contact with COVID-19 patients, they have to be isolated or they have to remain in quarantine for 2 to 14 days, that is for 2 weeks, and this is the sole reason for that. Because in many cases, most of the cases we have seen, or the health experts have seen, that it takes mostly 2 to 14 days. In some cases it may take 21 days also to show the proper symptoms and signs for COVID-19. Now there's one more thing called asymptomatic persons. There are many persons, those who may be having the virus, but they won't be showing the symptoms. And these persons, they are the real threat, because eventually the person itself won't be knowing that he or she is having COVID-19 and they will be spreading the COVID-19 virus. So it is very, very important that once you come in contact, once you get to know that you have been in contact with any person who is having COVID-19, then you should remain inside or you should undergo isolation for 40 days or for 2 weeks. Symptoms shown by COVID-19 patients are now the symptoms which are usually shown by COVID-19 patients are categorized under two categories. That is, common symptoms which are shown by majority of patients, and then there are some less common symptoms which are shown by some of the humans. First is coughing, then fever, then shortness of breath, and then sore throat. They come under some common symptoms which are usually present in most of the COVID-19 patients. Then comes the less common symptoms, and these are headache, runny nose, problems with the sense of smell or taste, nausea, diarrhea, a rash or a skin or discoloration of fingers or toes, and conjunctivitis. So these are some of the symptoms which are shown by patients of COVID-19, but ultimately by undergoing testing only it will be possible for you to get to know whether you are suffering from COVID-19 or not. You have to ultimately go for the test. Once your body is showing these symptoms, the first thing that you have to do is you have to go for the testing. आपको टेस्ट करवाना है, and once your testing is then only you will be get to know whether you are having COVID-19 or not. So now let's see who is most at the risk of becoming serious ill if they are catching COVID-19. Usually, what it has been seen that children and adults, those who are catching COVID-19, they recover, but people, especially those who are 60 and above, yes, those who are 60 and above, those who are having some other health problems like cardiovascular diseases or diseases related to heart, diabetes, chronic respiratory diseases, and cancer, and some persons those who are having weak immune system or their immune system is not working properly. So these persons, they are having chances of getting seriously ill if they contact, like if they get in contact with COVID-19 virus. So the next thing is what to do if you think you have it. Suppose अगर आपको लगता है कि आप की बॉडी कोविड-19 सिम्टम्स शो कर रही है, तो आप क्या करेंगे? What you will do if you are getting a feeling or if your body is showing any signs or symptoms that we have already discussed related to COVID-19. So the foremost thing that you will do is you will stay home. Once you feel that you are having a mild fever, or you are coughing or sneezing, so eventually what you will do, you will stay inside your home. You will avoid going to public places, you will avoid meeting people. You will stay home. As most of the people, those who are suffering from COVID-19, they are having very less to mild illness. So, and these mild illnesses can be cured inside your home without much medical care. So the first thing that you will do is you have to stay inside your home and you have to be connected with your doctors via phone calls or via video conferences, whatever it is. The next thing, if you are having trouble breathing, suppose आप सांस नहीं ले पा रहे हैं, then the first thing you will do is you have to call your doctor. You have to tell him that you are having trouble in breathing and you have to follow his advice, whatever he or she is telling you to do. Whether he will say you to admit, whether he's saying you to get admitted in the hospitals, or you have to take some other medications. So whatever the doctor is saying, you have to follow it religiously. Now the third thing is follow your doctor's advice and keep up with the news on COVID-19. Knowing about COVID-19 is very important. So you have to keep up with the news about COVID-19 and then you have to religiously follow your doctor's advice. You have to take the medications given by the doctors. You have to practice what all advice he has told you to do religiously. So as we all have seen that regarding the treatments, you must have seen in the news that to date there are no specific vaccines or any medicines for COVID-19. Researchers are still struggling to find a vaccine, to make a vaccine, to find a medicine for COVID-19. Treatments are under investigation and they will be tested through trials, clinical trials. First, they will conduct the clinical trials, and then only we will get vaccine or medication, medicines related to COVID-19. So till the medicines are under investigation, you are supposed to follow self-care. Self-care is the main aim that can heal you through this. If you are sick, if you know that you are sick, then first thing you will do is you have to consult your doctor, then you have to drink plenty of fluid, you have to eat nutritious food, you have to stay in a separate room for other family members to avoid transmission of disease. Then you have to clean and disinfect frequently touched items or substances which you are frequently in contact with. You have to clean those substances and disinfect to avoid transmission of COVID-19 virus. As we all know that prevention is better than cure. So rather than contacting the disease, it is better to be prevented in advance, to follow some preventive measures so that we may not get contacted with the COVID-19 virus. So first step for prevention is you're supposed to wash your hands regularly using soap, water or alcohol based hand rubs. Because you are supposed to sanitize your hands whenever you are going outside, whenever you are touching some foreign substances or unwanted substances. Quickly after touching those substances or surfaces, you are supposed to use a sanitizer or you're supposed to wash your hand using soap. Next thing is wear a mask, save lives. You are supposed to wear a mask whenever you are going outside or whenever you are talking to some other person. You may not know that the other person is free from COVID-19 or not. He may be asymptomatic. Maybe you are asymptomatic. You are not aware about it. So you have to wear a mask whenever you are going out and you are getting in contact with some other people. Keep a safe distance. Always try to keep a distance more than 1 meter or 2 meter from the other person. You have to keep a proper safe distance to avoid the transmission of water droplets or COVID-19 virus. Next thing that you will do is avoid going to crowded places. So what happens here is that whenever you are in a crowded place, it will be impossible for you to maintain a safe distance. The distance which is required, that is more than 1 meter, 2 meter, will not be possible for you to maintain in crowded places. So hence it will be hence the chances of getting COVID-19 will be more in those areas. So avoid going to crowded places. And the third thing is make sure you and the people around you follow a good respiratory hygiene. What comes under good respiratory hygiene? That is, whenever you are coughing or sneezing in public, use a tissue paper. And once you have coughed and sneezed into the tissue paper, you are supposed to throw the tissue paper properly into the dustbin. And if you're not having your tissue paper, if you're not having any handkerchief or tissue paper, what you will do? You will cough inside this elbow, this bent of the elbow. You have to cuff like this in the bent of your elbow if you're not having tissue papers. Now moving on to the next thing, that is, we have seen here the foremost way of preventing ourselves from COVID-19 is by washing our hands. So there are 8-step strategies, 8-step process how you will wash your. As we have seen that washing our hand is the foremost thing that can prevent us from getting contacted with COVID-19 virus. So there are 6 ways in which we can properly wash our hand to avoid viruses. The first thing is you have to wet your hands with water and then apply soap and sanitizer and rub hands with each palm. You have to rub your palm in this way, and then you have to rub the back of your palm. Okay, you have to rub the back of each hand with opposite palm. And after rubbing back of the hand, you are supposed to use your fingertips. You're supposed to rub your fingertips. You're supposed to rub your fingertips in opposite palms to wash the nails. Okay, by this we are washing our nails. Viruses which can remain inside the nails are being washed. Then we will rub in between the fingers. You can see here, we will rub in between the fingers. Once we have rubbed in between the fingers, then we will be cleaning the area around our thumb. Both the thumbs of both hands will be cleaned. And once you have washed your palm properly, you will scrub the wrist area. As many people are wearing wristwatches or bangles, so there are chances that virus may retain at this portion also. So you have to scrub both the wrists properly, and then you will rinse off all the soap with the water. And you have to keep your nails short. Keeping your nails short is a very necessary thing, as if you have longer nails, virus can retain inside them, and then you will be eating your food with your hands, they can go inside your body. So you have to keep your nails short, and please remove your wristwatch and rings. Avoid wearing wristwatch and rings when you're going outside. Try not to wear wristwatch and rings to avoid getting contacted with viruses. And the next important thing that you're supposed to know is how to wear a non-medical fabric mask safely, as most of the people are using non-medical fabric mask. So it is very necessary to know the steps of wearing it safely and properly. So the first step is clean your hands before touching the mask. Before you are using the mask, before you are touching the mask, you have to clean your hands properly with soap, and then you have to inspect the mask for damage or if dirty. If the mask is dirty, you can wash it, you can use another mask. Then adjust the mask with your face without leaving gaps on the sides. You have to keep this thing in your mind that the mask which you are using is not leaving any gaps near your nose or near your mouth, because if there are any gaps, it will be easy for virus to enter inside your mask through those gaps. Next is you have to cover your mouth, nose and chin. We have seen many people, they are wearing masks but their nostrils will be open. Some people, they will cover their nostrils, their mouth will be open. So it will be of no use. Whenever you are wearing a mask, you have to keep this thing in your mind that you are covering your mouth, nose as well as chin. Now, avoid touching the mask. When you have put your mask, you're not supposed to touch it again and again. Clean your hands before removing the mask. Before removing the mask, you have to clean your hands again, and then you have to remove the mask by straps behind the ears. You're not supposed to remove the mask like this because virus may be present in the front side of the mask. So you have to remove the mask by the straps behind the ears. Then pull the mask away from your face. Do not keep it near your face. Once you have removed the straps, you have to keep the mask away from your face, and then store the mask in a clean plastic. Please store the mask in a clean plastic, and do not mix your mix your mask with other mask or mask of other family members. सबको बोलो अपना अपना मास्क अपने अपने पॉली बैग्स में रखने के लिए, और whatever bags you are using, keep your mask safely there. Resealable bag if it is not a dirty or wet and you plan to reuse it. If it is a reusable mask, then keep it safely. If not, then you have to dispose the mask safely. Remove the mask by the straps, and when taking it out of the bag, you should always remember, and whenever you're again taking the mask out, you have to remove the mask, or you have to take the mask out of the bag using its straps that are at the end of the mask. Wash the mask in the soap or detergent, preferably with hot water at least once a day. Wear a mask, and daily you are supposed to clean the mask, okay? And once you are done with all the activities, again clean your hands with soap and water. These are some of the steps that you have to follow daily. You have to follow these steps religiously. Dear students, as COVID-19 is a mild infection and not life-threatening, please follow the preventive measures that we have discussed earlier in the slides and keep yourself and others healthy. Remember, if you're feeling sick, stay at home and call your doctor, as by taking these practical steps, you can protect yourself and others near you, and also you can help in slowing the spread of virus. You can stay up to date with the latest guidelines and recommendations at the website of World Health Organization as well as on Ministry of Health and Family Welfare website. So keep updated, be aware, prepare and always act accordingly. Thank you.